I'm going to talk about is very confusing, incredibly self-serving for those who have an interest. And this is a controversy I'm going to call the Webster technique. How many of you are familiar with the Webster technique? All right, one or two. Very good. For those of you, and I ask, where do you, the boards, stand on this question? And it's often silent and confusing. Now, from my last analysis, 49 of the 50 states' scopes of practice exclude obstetrics. So, is the Webster technique within the scope of practice or not? Do the boards consider this technique to be obstetrics? Now, can you see the confusion with boards that approve CE courses on this very subject, and then the statutes or the scopes not permitting the utilization of the very subject matter they approved CE courses for? So let me state the position of NCMIC as we clearly tell the doctors who continue to call us on a regular basis after every one of these seminars. If it, in this case the Webster technique, is ruled by the examining board or a court or another entity with authority to be within the scope of practice and not considered obstetrics, it's covered. If it's ruled by the examining boards or a court or another entity with authority not to be in the scope of practice, it is not covered, as our policy excludes activity not within the scope of practice. If it's ruled by an examining board or a court or another entity with authority to be within the scope, but is determined to be obstetrics, our policy excludes obstetrics. And none of those determinations, ladies and gentlemen, are made by us. And they will be different depending upon the specific state, the courts, the jurisdictions, and the interpretations by those who have authority to make that determination. You see the confusion this thing creates? It's a nightmare. So clearly the actions by the boards and the clarity with which the boards post their policies is not just important, it's vital in how the doctor's coverage is directly affected. The boards set the standards, not NCMIC or any other liability company, and we are often at a loss to explain to the doctors why their states have not responded to these very issues. Now that concludes the Webster test. It's just another one that pops up and percolates. It's like a thorn. And I hope you'll discuss this as an agenda item and come to some resolution